Hey mamas, I am going to show you guys how you can test yourself for diastasis recti. Now if you're not sure what that is, I'm going to give you guys a quick breakdown of what it is and what it means. Diastasis recti is the abdominal separation that occurs along your linea alba. Your linea alba is the connective tissue that connects your left and right abdominal muscles together. Now this separation occurs as a result of pregnancy. As the little baby inside your belly grows, the belly has to grow to accommodate it, and it does this by having that linea alba stretch out, which causes your left and right abdominal muscles to separate, causing that gap. Now before you panic, know that this is actually quite normal. 2 out of 3 moms have diastasis recti in their 3rd trimester, and about 50% of moms have it following giving birth. Now that gap, or that interrecti distance, IRD for short, is measured in finger widths. And while all moms experience some level of abdominal separation following giving birth, you're considered to have diastasis recti if that gap is more than 2 fingers wide. Now, when we check for diastasis recti, we are checking for 2 things. The first thing that we are checking for is the width of that gap, or the interrecti distance in finger widths. And the second thing we are testing for is the depth of that gap, or the quality of that linea alba and our ability to contract it. Now this is the most important part of healing diastasis recti. So the gap can and will close some, but the most important thing is restoring the integrity of that linea alba. For me personally, after I had my daughter, I had about a 3-finger wide gap at its widest point, and it's now down to just a barely 1-finger gap. And initially the depth of, or the lack of quality of my linea alba was very squishy. I couldn't contract or engage it. And now I can fully engage my core and pelvic floor. So I'm not considered to have diastasis recti anymore. So know that it can be healed, and usually without surgery, as long as you have the right program and the right coach to get you there. Okay, so let's get to it. Now, first of all, when we are getting into the position to test for diastasis recti, we're going to be rolling from our side onto our back. And the same when we're getting out of the position, you're going to roll to your side first. And we do this because just rolling backwards or crunching forward is going to add pressure to your abdominal wall and actually make that diastasis recti worse, can make the gap larger. So until we can properly engage our core and pelvic floor, we want to make sure we're avoiding any of those crunching, bulging positions. So go ahead and roll onto your side, and then roll onto your back. And we are going to be in glute bridge position. You're just going to have that neutral spine. You don't want to be overly arched, and you don't want to be tucked under. Just neutral spine, that natural arch in your back. And first, we're just going to feel along our linea alba. We're just going to get an idea of what it feels like and feel how squishy it is, how maybe firm it is, depending on how far along you are in healing your diastasis. And just get a general idea of what it feels like without engaging your core. Now, earlier I said that we test for 2 things when we check for diastasis recti, width and depth. So first we're going to test for the width of our gap. Step 1 when it comes to testing is you're going to take 3 fingers and you're going to place them just above your belly button. When we test for the width of our gap, we test it at 3 places. We test it just above the belly button, 3 inches above, and about 3 inches below. Now the widest part is going to be right around your belly button. So you take those 3 fingers and you just sort of press them gently into your linea alba. Step 2, we're going to be gently and softly lifting our head off the floor. This isn't a crunch. Like I said, that crunching is going to bulge your stomach. It can make your diastasis worse, so we're just lifting the head off the ground for a short amount of time. Step 3, as we're doing these steps together, as we're pressing into our linea alba and lifting our head off the floor, you're going to feel that abdominal muscles wrap around your fingers, and that's how you're going to know how wide that gap is. Your gap could be larger, it could be smaller. If it's larger, if you can't feel the abs wrapping around your fingers, go ahead and add fingers from this other from your other hand. That pinky's too small to measure. And then if it's less, just take fingers away. So 3 fingers is a good place to start with. So you're just going to press into that linea alba, lift your head. Take and add fingers as necessary until you get a good idea of how wide that gap is. So like I said, mine started out as a 3-finger gap at its widest point, and now it's down to just barely a 1-finger gap. So next we're going to repeat those same steps about 3 inches above our belly button. So press 3 fingers in, lift, take away fingers or add as needed, and just get the measurement of that inner recti distance. Now we're just going to repeat the same thing about 3 inches below the belly button. Okay, so once you know what the finger width gap of your diastasis recti is, you now have the width. You know how wide your gap is. So the next thing we're going to be testing for is the depth or the quality of our linea alba. So to start out, we're going to be starting out the same way. Step 1, take 3 fingers and place them just above your belly button. And you're going to press into your linea alba. The second step, before we lift our head, we're going to engage our core and our pelvic floor. Now, you probably know how to engage your core, just to tighten up and flex your core. The same thing you would do if someone was about to punch you in the stomach. You would flex your abs, or you can think about pulling your belly button up and into your ribs, and that will help you engage your core. Now you're also going to be engaging your pelvic floor, and this can sound confusing to some people, and this is also known as a Kegel. It's the same thing that you would do if you were to stop your pee midstream when you're going to the bathroom. So it's those same muscles that you would pull up when you're going to the bathroom to stop your pee. So just to start out, we won't lift our head yet, just give that a shot. Try contracting your core and your pelvic floor at the same time. Now if you have difficulty doing this, don't stress out. If you're like, well, I can't do it, don't worry, that's normal, and it's part of what we're testing for. We're trying to get an idea of whether you can engage your core, and that gives us an idea of what needs to be worked on. And it's totally normal following giving birth, and it is fixable. So now we're going to go ahead and add that head lift. So you're going to take the 3 fingers, you're going to press them into your linea alba, and then you're going to take a deep breath in, and then exhale. On the exhale, tighten up your core, pull up your pelvic floor, and lift. Now take away fingers as necessary, or add as necessary. Now what we're testing for here, what we're feeling for, like I said, is the depth. So you want to see how firm that linea alba is when you engage your core. Is it tightening up? Is it as squishy as it was before? Is it tightening up at all? Is it a little bit more firm? That's what we're really seeing. We're comparing it to the non-contraction towards the contraction state. So go ahead and test the same thing, 3 inches above, and again 3 inches below. Alright, so roll from your side back up to get out of the position. So that's how you test for diastasis recti. If while testing for this, when you were testing for the width, if you had a gap that was more than 2 fingers, or if you had trouble engaging your core and pelvic floor, if your linea alba was still squishy even when you were trying to engage your pelvic floor, don't worry, don't stress out. That is totally normal following giving birth, but it does mean that you have diastasis recti and it does need to be healed. Now, when it comes to healing diastasis recti, it involves reconnecting your core with your pelvic floor, and we do this by targeting those deep abdominal muscles, your transverse abdominis, with different exercises to help stabilize your core. And we also use different breathing techniques to reconnect your core and pelvic floor to get them working back synergistically together so that we can, again, re-engage our core. And it also involves correcting different alignment issues that are common following pregnancy. Now, if you're looking for a program to help you do all of this, I have good news for you because next month my Mom Bod Restored program is being released. It is an 8-week program designed to do exactly that, to restore your postpartum body and get it functioning at full force. So it's going to help heal up your diastasis recti, strengthen up your weak pelvic floor. It's going to correct several alignment issues that need to be corrected moving forward. And it's just going to give you a solid foundation to move forward on and get you back to the exercises that you might have liked to do before pregnancy or during pregnancy that you want to get back to. And even if you don't like exercise, it's going to give you a solid foundation just moving forward in general, because it's going to help your body function more properly. It's going to take away your lower back pain and correct different issues that are important to be corrected, whether you're exercising or not, just for a better quality of life. So if you want more information on this program, or if you have any other questions regarding pre or postnatal fitness or just fitness in general, please feel free to reach out to me. And thank you guys for watching this video, and I really hope it was helpful to you.